Always very sobering and very instructive. Next, I'll ask Dr. Holterman to introduce Dr. Quynh. Dr. Quynh hails from Hanoi, Vietnam. Dr. Holterman.
Hello. I'd like to thank the APSA Foundation and Sidra Foundation for this wonderful opportunity to introduce Dr. Quynh. He's the first international travel surgeon from Vietnam. He's a skilled pediatric laparoscopic surgeon in colorectal surgery. How do we meet him? We had this organization called IPSAC Vietnam, which was founded as an NGO with the goal to enhance patient care in Vietnam through workforce and institutional capacity building with a lot of focus on education and training. We met Dr. Lim. Many of you may know of him at National Hospital Pediatrics in Hanoi. And he's an extraordinary surgeon, but also a transformative leader who really put Vietnam, which is still is a developed country, onto the map in pediatric surgery. And he has identified Dr. Quynh as a future leader for his program. So as with many surgeons in Vietnam, Dr. Quynh has a lot of pride in his technical skills and is kind and humble. But I think that the country is now poised to move beyond perfecting surgical skill into total patient care and outcome research. And this opportunity for him to come is a way for him to have a professional development, to enhance the care of the children in Vietnam. But with our organization, this is an opportunity for us to collaborate, whether in training, education, or research, enrich our pediatric surgical experience the way that Vietnam has affected us. So I would like to welcome Dr. Quynh, please.
Good morning, Dr. Holterman, APSA member and guests. I would like to, my name is Tran Anh Quynh. I work at National Hospital of Pediatric in Hanoi, Vietnam. I would like to present the development of pediatric surgery in Vietnam. The first I thank you for the support, especially the APSA and University of Illinois and Children's Hospital of Illinois, Peoria, Nationwide Children's Hospital Columbus, Children's Hospital Omaha, Nebraska, Children's of Alabama, Birmingham, and IPSAC Vietnam. I like to talk about Vietnam. Vietnam is the size of New Mexico, population more than 19 billion people. Children under 15 years old account 30% of the population. It's more than 8,500 miles away, and per capita annual income in $1,900 US. Vietnam is a beautiful country for tourism. I would like to show you some picture in my hospital, my country, in Hanoi and Central Highland, Sapa, Hạ Long Bay, Huế, Ho Chi Minh City, Hội An, and Mekong Delta. The Hanoi Medical University founded in 1902, and the Viet Đức Hospital is the first surgical hospital was founded in 1906, with Dr. Tôn Thất Tùng, famous for hepatectomy technique. National Hospital of Pediatric in Hanoi, Vietnam was founded in 1969. In new hospital was built in 1981 and with 1,100 beds. Key function of NSV. their patient care, training, outreach, research. About patient care, my hospital are the main tertiary referral center for pediatrics in Vietnam. It covers around 30 million population, with 1/3 patients from Hanoi and the rest from provinces. My hospital train medical students, medical doctor, continuing education, international training. Outreach activity. We are protocol and policy for pediatric care, expanding community child care program. My hospital is a center of research and community research in child health, pediatric preventive care, diagnosis and treatment, new advanced technique and protocol in patient care. Development of pediatric surgery. The first pediatric surgery department was founded in 1957. Currently, we have 20 pediatric hospitals with more than 150 pediatric surgeons. Professor Nguyễn Thanh Liêm, who is an international leader in development novel techniques and laparoscopic in Vietnam. The number of general pediatric surgery cases at my hospital is increased from 2000 to 2008, and last year in 2013 we have more than 15,000 cases. The development of specific technique at my hospital. About collection consists the first Vietnamese international publication in 1963, and the first laparoscopic removal in 2007. The first single incision laparoscopic surgery in 2012. Dr. Liêm published 400 patients for laparoscopic surgery for choledochondritis in 2003. Biliary atresia. The first Kazai procedure we start in 1994, and patient survival more than 50 years. The first laparoscopic repair 2008. Dr. Liêm reported in 2010. About congenital diaphragmatic hernia. The first thoracoscopic repair in 2006. Dr. Liêm reported 139 cases for a thoracoscopic repair for CDH. And about PDA ligation. The first thoracoscopic PDA ligation we start in 2010. Dr. Liêm reported a randomized clinical trial in 2014. And TEF, the first survival in 1987, and present survival more than 80%. The first thoracoscopic repair 2007. About Hirschsprung disease. We start laparoscopic in 1997. We have reported in 2006, and we developed modified posterior sagittal in 1998, and we have reported in 2005. And the first triannual approach in 2002, and the first single incision laparoscopic surgery 2012. About for imperforate anus, Dr. Liam development on state modified PSAP in newborn in 1998. He reported in 2001. And we started laparoscopy 2005, and we have a single incident laparoscopic surgery in 2012. Dr. Liam first reported in combined laparoscopic and modified posterior sagittal approach, saving the external expander in 2013. My hospital has separated 5 cases consenting, and my hospital performed liver and kidney transplantation since 2004, and we have performed bone marrow transplantation since 2006. And about my experience in pediatric surgery, I graduated from medical school in 2001. I finished training in pediatric surgery and master pediatric surgery from 2006. And about penile approach for imperforate anus. Now I working on PhD laparoscopic approach to high imperforate anus. Here I selected my selected publication. Current limitation at my hospital. In my hospital, it's sufficient financial resource, equipment and instrument. Teamwork need to improve. I hope that this conference and my visit to U.S. Children's Hospital helped me to strengthen hospital management, to improve the diagnosis and treatment procedure for pediatric patients, to continually develop and perfect surgical techniques, particularly in laparoscopic surgery for pediatric foragus and high gut disease, to strengthen international cooperation, network, and learning in pediatric surgery. Thank you for the chance to present to the organization. Thank you.